Good morning. Today we are going to study about scleral lenses, outlines, scleral lenses, theology, anatomy, history, indication, design, lens fitting, adverse effect, patient complication, and future hopes of scleral lenses. First one is scleral lenses, also known as hepatic lenses. Hepatic means sense of touch. A large diameter rigid contact lens that cover the entire surface and rest on cornea. Diameter of scleral lens diameter is 15 mm to 25 mm. The minimum or no contact on the cornea. And theology means the terms are given for the contact lens. Name is corneal. Alternative names is not have. Its diameter is 8.0 to 12.5 mm. Bearing, all lenses bear on the cornea. No tear reservoir is present for corneal contact lenses. Next one is corneoscleral, corneal limbal semi-scleral limbal is 12.5 to 50 mm lens bearing on the cornea and the lenses. Limited tear reservoir capacity is only have, and full scleral or means a hepatic. First one is diameter is 15 to 25 mm and mini scleral is 50 to 80 mm. Large scleral is 80 to 25 mm. All lenses bearing somewhat limited tear reservoir capacity, almost unlimited tear reservoir capacity. Next one is ocular anterior anatomy. Average corneal diameter is 11.8 mm. The maximum diameter a scleral lenses can have is 24 mm. History: the first scleral lens is made of glass blowing shells with a large size, causing pain, discomfort, and complication in 1880s. In 1940s, discovered PAMA, but low oxygen permeability, decay almost zero, and oxygen deprivation. Next one is cause corneal edema and neovascularization for when we are using the PAMA contact lenses. In 1970s, we used the scleral lens where disused soft contact lens and RGP are performed. Back to the market. Now we are using a back to the market to fit a more challenging eyes. Next one, when it started. Scleral lenses is used to fit on corneal disease, irregular corneas. To form a manufacturing lens is spin cast, mold, or lathe cut customized made. Scleral lenses are lathe cut, high cost, making it unpopular. And next one, why is scleral lenses is not popular? It's too expensive, large lenses diameter difficult to fit, lack of expert to fit, complication when patients wear it overnight. So scleral lenses are not popular. Indication: vision improvement, corneal protection, cosmetic spots, and drug delivery. It's the main uses or indication of the scleral lenses. And indication: what the first indication is vision improvement, mainly a corneal dysphagia case, primary keratoconus, keratoglobulus, and PMD. Secondary, the post-refractive surgery like LASIK and PRK. Other condition is post-trauma corneal scar due to infection to restore the improved vision. And corneal protection in two conditions: severe ocular disease and incomplete lid closure. Example: eyelid glaucoma, entropy, exophthalmos, nerve paralysis. Help to reduce the corneal explanatory air. Benefits to relieve symptoms of pain and discomfort. Keep ocular suffers most in severe dry eye, but fluid reservoir retain. Slow the progressive of a corneal disease and delay the need of surgery. Decrease a risk of scarring. Next indication is cosmetic. In prosthetic lenses, full ocular prosthetic and partial prosthetic lenses are there. Using for aniridia, albinism, trauma and nanophthalmic spots. More secure, risk reduce risk of loss, provide stable vision and comfort. Drug delivery. Scleral lenses are tear reservoir. Instilled drugs is blows to the scleral lenses. RGP is not suitable for the drug delivery due to the lens movement. Normal eye, very common in other countries. Corneal lenses cannot fit well. It's give less complication. And designs of scleral lenses are corneal clearance, hepatic lenses, and optical zones and transitional zones. Corneal and scleral are given. Designs of scleral lenses is optical zones, minimal not contact with cornea, RGP contact, large size, RGP smaller, given optical effect, suffers anterior surface aspherical designs to reduce photophobia and aberration. The posterior suffers same shape as cornea. Surgical height of scleral lens is higher than RGP surgical height. Available in toric, transitional zone. Only scleral lens has transitional zone connecting a sclera and sclera. It is set of surgical height. Changing a surgical height means changing a transitional zone depending on the shape of the sclera. The transitional zone of small diameter is scleral contact lens may rest on a limbal area, not the large diameter of scleral lenses. Range of transition zone is 0.5 mm to 2.0 mm. Designs of scleral lenses in transition zones is referred to corneal, limbus and scleral effect of scleral contact lens fitting involving the transitional and landing zones. The scleral can be evaluated using a panoramic anterior segment OCT. Types of limbal: gradual convex, gradual tangential, convex, concave, make convex, marked tangential. Transitional zones. What? This is the angle between iris and cornea. Temporal angle larger than nasal angle. Cornea scleral easy descended to the nasal. However, it would not affect the vision because of the optical zone is large. Landing zones, area of scleral contact lens that rest on a sclera. Important to know size of the landing zones, angle of landing zones. Landing zones as back surface toric change the thickness at one side, can make peripheral toric by thickening the edge like prism blast. Increase diameter of landing zones make it more comfortable to wear as less movement produce. Thank you.